How to manage type 2 diabetes through diet and exercise. Medication may be necessary for the management of diabetes. On the other hand, some methods can assist in the management of illnesses that do not need the use of medicine. Alterations to one's lifestyle, such as dietary and physical activity habits, are typically included in this category. Keeping blood sugar and blood glucose within a healthy range can be accomplished by people through the implementation of a variety of lifestyle changes. Among these are consuming a diet that is well-balanced, engaging in regular physical activity, and preserving a moderate weight. If alterations to one's diet and lifestyle alone are not sufficient to successfully maintain a healthy blood sugar level, medical specialists may recommend that the individual take medication. The management of type 2 diabetes without the use of medication is the topic of today's video. In addition to this, it investigates the factors that lead to type 2 diabetes and the circumstances under which individuals might require medication to control the condition. It is possible that those who have type 2 diabetes or risk factors for the condition could benefit from adopting healthy lifestyle behaviors. These kinds of measures can manage the condition or perhaps put it into remission, as well as they can delay or prevent its development. Healthy lifestyle measures may assist in lowering blood sugar levels. Make an effort to manage your weight. People who are overweight or obese may have a reduction in their blood sugar levels to a healthy range if they lose a large amount of weight. Keeping a nutritious, well-balanced diet and engaging in regular physical activity are two methods for managing one's weight. Individuals who are at risk for developing type 2 diabetes should seek guidance on how to manage their weight by consulting with a nutritionist or a healthcare practitioner. Find out more about how to lose weight while having type 2 diabetes. Consume a high-quality diet. Consuming nutritious meals in the appropriate amounts while avoiding or restricting the consumption of items that are not nutritious is the foundation of a diet that is both healthy and balanced. According to the American Diabetes Association ADA, eating healthily is characterized by the consumption of particular meals, regardless of the type of cuisine that an individual enjoys. Foods such as these include lean cuts of beef or proteins derived from plants, a variety of plants and fruits, meals that are less processed, fewer foods that have extra sugar. The American Diabetic Association ADA also recommends adopting the diabetic plate method. To assist with the management of portion sizes entails filling a plate measuring 9 inches in a particular manner. When using the plate approach, filling is involved. Vegetables that are not starchy make up half of the plate. A quarter of the dish should be filled with carbohydrates and a quarter of the plate to be filled with protein. In a review published in 2020, it was found that the Mediterranean diet has the potential to be a beneficial eating plan for individuals who have type 2 diabetes. Find out more about the foods that are appropriate for diabetics to consume. Exercise consistently. Physical activity helps to maintain healthy blood sugar levels and burns calories, both of which contribute to weight loss. Moreover, physical exercise raises insulin sensitivity, which facilitates the process by which blood sugar is transported from the bloodstream to the cells. The Centers for Disease Control and Prevention (CDC) recommends that individuals strive to engage in moderate physical exercise for at least 30 minutes on most days of the week, to accumulate a total of at least 150 minutes of such activity each week. Even a fast walk might be considered a kind of moderate physical activity. The Centers for Disease Control and Prevention (CDC) suggests exercising vigorously for 75 minutes per week, such as by jogging or running. Adding activities that build muscles at least twice a week is another recommendation made by this article. Give up smoking. For better managing type 2 diabetes, medical specialists recommend that individuals give up smoking. Persons who smoke have a risk that is 30 to 40% higher than persons who do not smoke when it comes to acquiring diabetes, as stated by the American Heart Association (AHA). In addition, smoking causes a temporary increase in blood sugar, which presents an additional problem when it comes to maintaining normal blood sugar levels. The probability of a person having complications of diabetes, such as kidney disease and nerve damage, is increased as a result of this. Discover more about the relationship between smoking and diabetes. Learn to distress. An investigation that was conducted in 2019 reveals that although stress does not cause type 2 diabetes, it can make the condition worse. When we are under stress, our bodies release hormones that disrupt the normal regulation of our blood sugar levels. In addition to this, it makes a person more prone to participate in behaviors that make it more difficult to control their blood sugar levels, such as smoking and consuming an excessive amount of food. Taking a break from electronic devices and spending time in natural settings are two methods that can be utilized to alleviate stress-related symptoms. When to change to a different medication. In most cases, a person will only require medicine from a trusted source if the lifestyle choices they make do not assist in the management and maintenance of their blood sugar levels. There is a possibility that the age of the individual at the time of diagnosis will have a role in the suggestion that a healthcare practitioner makes regarding medication to assist in the management of type 2 diabetes. Even though many older persons who have the illness have somewhat higher blood sugar levels, this phenomenon rarely results in any problems. On the other hand, medical experts can administer medication to individuals who have received a diagnosis by the age of 40 or 50 years. Sugar levels in the blood can eventually contribute to health problems, such as damage to neurons or blood vessels, even if they are only slightly increased. One of the potential problems that could arise from such injury is kidney disease. Medications are used to delay or prevent the negative effects that diabetes can have. Because there has not been a significant amount of research conducted on the impact of lifestyle changes alone on type 2 diabetes, there are not many statistics available on the outcomes of such interventions. On the other hand, a clinical trial that was conducted in 2018 and referred to as Trusted Source investigated the results of a weight management program on 306 people who had type 2 diabetes. Approximately 50% of the people who took part in the program went into remission after 12 months, according to the findings of the authors. At this point, researchers are unable to precisely measure the amount of improvement that individual healthy living practices may bring about. The prognosis, on the other hand, is more favorable for individuals with type 2 diabetes who make the lifestyle modifications that are indicated than for those who do not. Causes of type 2 diabetes and the symptoms it manifests. Diabetes type 2 is a disorder that is characterized by elevated levels of blood sugar, which is also referred to as blood glucose. Insulin is a hormone that is produced by the pancreas. Insulin causes cells to accept glucose from the bloodstream and use it as a source of energy. Insulin resistance is a condition that occurs when cells do not respond to insulin as they normally would in persons with type 2 diabetes. Consequently, the pancreas produces a greater quantity of insulin to transport glucose into the cells of the body. After some time, the pancreas is unable to keep up with a rise in blood sugar, which ultimately results in the development of prediabetes and type 2 diabetes. Symptoms frequently manifest themselves over several years, including the following: exhaustiveness, dry skin, increased thirst and urination, blurred eyesight, increased hunger, slow healing of sores, numbness or tingling in the hands or feet, and weight loss without testing the medication are all symptoms that may be experienced. Individuals who are interested in learning how to manage type 2 diabetes without the use of drugs are encouraged to make adjustments to their lifestyle, such as adopting a healthy diet, engaging in regular physical activity, and, if required, giving up smoking or refraining from smoking altogether. In some individuals, losing weight might also assist in the management of their blood sugar levels. An individual who has type 2 diabetes should make sure they are getting a healthy diet. The Mediterranean diet is one example of a nutritious eating plan that may help manage blood sugar in ways that are not related to weight loss. There is some evidence to support this hypothesis. Individuals who have issues regarding the management of type 2 diabetes, whether with or without the use of medication, are encouraged to consult the healthcare practitioner. Enjoy the breakdown. Hit that like button, subscribe for more game-changing content, and drop a comment below.